Welcome to Health Matters. We've been talking about aging. We're very fortunate to have with us Dr. Adam Mamalak, a dermatologist at Credit Valley Hospital. Dr. Mamalak has a large and growing practice in the field of dermatology, and he cares for a lot of the elderly. We're here to talk about the aging skin, and I'm sure this is a great dilemma for many people who are aging. How do I keep my skin young, youthful, and how do I stay young and handsome? Well, to address these very important questions, we have Dr. Mamalak. Dr. Mamalak, let me ask you the question here. Why do we age?
You know, that's a very funny question, Colin, because this is not a new question. Think about it, the fountain of youth, Jason and the Argonauts. This question has been around for centuries, and there's folklore and there's stories about why aging takes place and what we can do about it. Now we're lucky. We have a bit of science behind it. We're starting to understand the theories, both on the cellular, the molecular level of what's happening in our body, what's happening in our skin, and why we're actually aging. There's actually two theories about aging and why we age. One is what's called the intrinsic theory and the extrinsic theory.
So what is the extrinsic theory of aging?
The intrinsic theory,
Yeah.
The intrinsic theory basically says that our entire body, every cell in our body has a clock. And this clock starts to tick down from the day that we're born. We reach a critical point where the clock runs out, and then our cells can no longer reproduce, we can no longer proliferate, and our cells begin to die. And this is exactly what contributes to the aging process. Now, I can show you actually in the skin, if we have a couple slides.
Sure.
So,
our first slide, yep.
So this is a picture of what the skin looks like under the microscope. You can see this is normal, healthy skin. The top layer, the stratum corneum, that locks in all of our moisture. The epidermis is that pink layer of cells, and the dermis underneath that's composed of collagen and blood vessels. As we age, all of these components decrease. The skin begins to thin. The epidermis thins, allowing more moisture to escape. We lose collagen, which gives us the plumpness and volume in our skin, and the blood vessels in the dermis become more and more fragile.
Are you saying that this is inevitable? Any determinants that make this aging skin quicker, faster, slower? Because I think I want to slow this process in my body.
There are things that we can do about this. There certainly are things, and we're learning more and more about this. What are the ongoing cellular processes that do this? Free radical damage in our cell, waste products that come from regular metabolic activities, and we know more and more about taking antioxidants to combat this and how to prolong our youthful skin. I can show you, if you like, what this looks like from a clinical point of view.
Sure.
When patients come in, they don't show me pictures of their skin under the microscope. This is what they show me. This is a picture of dry skin, excessively dry skin.
And they tend to get this more in the winter months?
Absolutely.
Yeah.
You're absolutely right. When the cool, dry weather affects us, our skin gets dehydrated, and more we're seeing this. We combat this by taking hot showers, which is probably the worst thing that we can do for our skin because it just dehydrates it more. The treatment for this is to rehydrate the skin.
Right.
Start using moisturizers, but more than you think you should. So don't put it on once a day. Put it on 2 or 3 times a day. Use thick, greasy creams, like even Vaseline ointment.
And true. And so when's the best time to be using it? And what should I be looking when I'm going to pick up a moisturizer? There are tons of them on the shelf. The most expensive one, the least expensive, or am I looking at a particular component?
It's more the consistency. I mean, there's different preparations, and people will like things depending on the perfume and how they feel and the elegance of the product. But the thicker creams, the ones that are more greasy like Vaseline, tend to lock moisture in better.
Okay.
I tell patients the best time to use this is right after the shower.
Perfect.
When their skin is still damp and a little bit moist, they can rub it on and it really locks the moisture in. But it's more than that. In the morning before you go to sleep. And if you do suffer from dry skin, you want to put it on multiple times during the day. Put it on when you get home from work, in the middle of the day. These things will really help.
What else do you see in the skin of the elderly?
Another problem that we frequently encounter, and I believe I have a slide of this, is what we call senile purpura. As I mentioned, the blood vessels in the skin get very fragile and can easily damage.
I see that all the time in my practice, the little blotches of red patches of...
Absolutely.
Yeah.
Patients will say, you know, they just bumped themselves accidentally on the side, on the counter, and they develop these massive bruises on their arms and on their hands. This is an ongoing process, and this is actually a very difficult thing to treat. The best thing to this is to protect the skin from an early stage on before you get to this point. Elderly patients often take blood thinners. This can compound the problem, and aspirin and all of these things that predispose us to bleeding. So really protecting the skin, ensuring that we decrease the trauma to the skin is really the best thing that we can do.
Now, you know, again with the elderly, you get these little patches of crusty, raised lesions.
They're signs of wisdom.
Ha!
So these are what we call seborrheic keratoses, and I believe I have a slide of this one as well.
Sure.
These are the most common skin changes that we see. These are small little warty papules that come up on the skin. They can appear anywhere, and actually these are genetic things. We get them from our parents. So really preventing these is a hard thing, but at least we know who to blame.
But I think it's important for our viewers to understand that any skin lesion that you have, always check it out with your physician, because it's not uncommon that some of these lesions could be squamous cell carcinomas, basal cell carcinomas, and not to take it upon themselves to treat it.
Absolutely, and the rates of skin cancer are now rising in exponential levels in the community. We've seen massive rises in skin cancer, in melanoma, and in non-melanoma skin cancers. So if there is a new spot and it's concerning, and particularly if it bleeds or it doesn't heal in an appropriate amount of time, which is about 2 weeks, you should definitely check it out with your physician and even potentially get a biopsy.
So give me a sense, Dr. Mamelak, what are therapies that are available to treat the signs of aging skin? What's available out there?
Well, there's a couple other things that we should talk about. There is an extrinsic component to aging. Extrinsic aging refers to the outside damage, the external forces that damage our skin. And by far, we talk about smoking, we talk about pollution, but by far the most common one is sun. We know now that UV damages the skin more than any external component. And it's interesting because we can look at skin, and we can look at skin that's exposed to the sun and look at skin that's unexposed to the sun, and we can see the compounded effects of UV on the skin compared to covered skin. And these changes we see all the time. And this, also UV, is one of the major causes of skin cancer.
But so, you know, we have a lot of immigrant population, people with dark skin like myself. They're always of the opinion, I've got this protective component here, therefore I'm not going to get so quickly exposed to somebody who has fairer skin. Do you want to comment on that understanding?
You know what? I'll tell you, I've seen skin cancer in African Americans, I've seen skin cancer in East Indians, in Asians, and Caucasians. Obviously, Caucasian skin does not have the built-in sunscreen that some more darkly complected individuals do, but we can still see this, and there's still stories about this. So I don't think anyone is immune to this. And
so sunscreen, and we are getting into the summer months, so sunscreen's important. What kind of one would you recommend, and what kind of an SF factor should I be looking for?
So you want to get a broad spectrum sunscreen to protect the skin, at minimum SPF of 30.
Okay.
And you want to make sure it says UVA and UVB protection.
How low can I go? I know we're talking about aging, but how low if I have kids? How low should I be going? I mean, can I be putting this on my infant baby? The
American Association of Pediatrics doesn't recommend sunscreen for kids under 6 months old.
Okay.
So after 6 months old, you can certainly start using sunscreen. Higher SPFs are more indicated in younger people. We get 80% of our sun exposure before the age of 18. So all of this sun damage that we're talking about, most of it happens actually in our youth. And our youth are the people that are outside the most. Our youth are the people that are using most of the tanning salons. And later, when we're older, we start to pay the price.
So you talked about intrinsic factors, you talked about the extrinsic factors. What other therapies are available in terms of to treat the aging skin or to prevent aging, other than trying to abuse my skin by going out in the sun and
Absolutely.
not, you know, what else?
So protecting the skin with sunscreen is one of the best things that you can do. And actually studies will show that if you use sunscreen on a daily basis, you will actually improve the appearance of your skin. Fine lines, wrinkles, and dark spots, all of these things will be improved. There are other things, and I believe I have some before and after slides that I can show you.
Okay.
Some of these are basically dark spots on the backs of the hands. This can be treated with various different laser therapies. So here's the before. With a laser therapy, we could basically erase these marks if you go to the next slide. And you can see that you can get clear skin.
Wow.
Another thing that we see are broken blood vessels on the next slide. And this is particularly evidence on the face. Again, there are now lasers that specifically target blood vessels in the skin. And if you look at the next slide, this is the type of appearance we can get. I believe the next slide shows the worry lines.
Right.
This is something we all think
Yes,
about when we
yes.
look in the mirror.
Yes.
Now we have therapies like Botox Cosmetic, which can be injected into these muscles, soften these muscles, and basically erase these dynamic
You raised an
gradients.
important point about Botox. Could you just, a question of caution, because we've been hearing a lot in the market. Who should I go to get my Botox injection? What criteria should I be looking for? What are the risks associated with getting Botox?
I mean, as long as the person that's doing it has been well trained, is a healthcare professional, and knows what they're doing, I think that would be the best thing.
And one way is always get a referral from your physician.
Always talk to your physician about this.
Now, tell me something. You know, I mean, the ladies out there listening to the program will say, you know, we go to the cosmetic section, and there's a ton of creams out there. That the most expensive one, they talk about rejuvenating your skin. Any advice in terms of what kind of creams they should be using, should not be using? What's relevant, not relevant? What's the market hype?
When I get questions about skin maintenance and health maintenance, I say there are three basic things. I call them the 3 R's.
Perfect.
Reflect, restore, and rebuild. Creams that reflect are sunscreens. Every day you want to put sunscreen on your face and the backs of your hands, because these are the areas that are exposed no matter what time of year. January, February, you are still getting UV damage on your face. So if you can reflect this damage, that's the best. Restoring your skin, use a good antioxidant. The most common ones are vitamin C and vitamin E preparations. There's coenzyme Q and other things. And restore, the vitamin A creams have been clinically shown to rebuild collagen in the skin to treat fine lines and wrinkles. Those are the 3 basic things that I recommend. The type of preparation that the patient wants, how elegant it is, that's really up to them.
Dr. Mamelak, you've done a great job talking about the aging skin. I think what I hear, the resounding that comes out from your presentation really is take the time to protect your skin, because prevention, like anything else, is going to validate and prevent deterioration of the skin, whether it be in terms of wrinkles, in terms of lines. And I think paying attention to your skin by moisturizing, the sunscreen that you mentioned, it will go a long way in terms of protecting our skin. Ladies and gentlemen, I hope you've had an understanding about what skin disease is like in the elderly. Moisturizing your skin is important. Don't make it worse by going in for warm baths. If you do have to have a bath, make sure when you do have a bath, make sure you use a moisturizing cream soon after. Any new lesion, see your physician for advice. Dr. Mamelak, thank you very much for shedding light on this very interesting topic of aging of the skin.
My
Thank
pleasure.
you very much.
Thank you.